This is Catholic Forum. I'm Bob Krebs. Dr. Stephanie Caffey is the founder and chief executive officer of Totally Yours Family Medicine. She's a family physician and an assistant clinical adjunct professor at McMaster University. With a passion for women's health and natural family planning, Dr. Caffey started Totally Yours Family Medicine to bring evidence-based medical care to Ontario residents. Her book is titled Totally Yours, the Catholic Natural Family Planning Handbook. It's a down-to-earth and practical book that uses real-life stories and experiences of over 20 couples to demystify natural family planning. I would like to welcome to Catholic Forum Dr. Stephanie Caffey. Thanks so much for being with us today, Dr. Caffey.
Thank you for having me.
We're going to be talking about your book and about natural family planning today. Before we get into that, tell us a little about yourself, if you would, please.
Sure. So I am a Catholic wife, mother, and family physician. I raised my 4 children with my husband in Ontario, Canada. And recently I also authored a book on natural family planning based on the generous experiences of many of my patients. And they share these experiences in this book to show people what natural family planning in practice looks like, along with some information about what it can do medically, how it can improve your life, and why the Catholic Church suggests that couples use it if necessary. Otherwise, I run a family practice that's virtual based on natural family planning and do lots of in-person work in hospitals and long-term care.
How did you decide to become a physician?
Good question. I didn't know what I wanted to be. So I actually applied in university to a wide variety of programs, but it was my 4 Polish grandparents, Polish immigrant grandparents to Canada, who came and faced various health challenges that inspired me to really pursue a career in medicine. My mom is also a nurse, so her influence also influenced this area of my life. And over time, just being able to volunteer at my local hospital and see my grandparents encountering various health struggles with strength and dignity was a beautiful experience that inspired me to pursue a career in medicine.
That's a great story. It's wonderful how grandparents can inspire young people to do things these days. It's a great story. Thanks for sharing that with us. So have you always been a proponent of natural family planning?
So I have always encouraged its use. I've known that the Catholic Church encourages couples to use it if they need to, if they're looking to delay pregnancy or space pregnancies. But I didn't know exactly the details. So I actually wanted to go as far away from it as possible. And I focused my training on the elderly. So my day job, so to speak, is working in nursing homes and a hospital. And I said, I don't want to deal with the ethical issues of reproduction and that sort of thing. I'll leave that for others. And then God had a different plan. So I ended up on one of my maternity leaves with my children, feeling really called after reading a book about physicians' experiences with natural family planning to learn this and to actually offer it to patients, because there are very few people doing it in my area where I'm located in Canada. So I ended up going through a training program through Marquette University. It was online, so it was quite flexible. And then I was able to open this virtual clinic where I can serve patients from my region and teach them natural family planning. So it was not the plan I had for myself, but the plan that God had for me. And in the end, God's plans are certainly better than our own.
It's funny how that seems to work sometimes. Yeah.
It's true. Yeah.
So in case our listeners or viewers aren't familiar, give us the basics. What is natural family planning?
Yeah, so natural family planning is using the different timing of a cycle. A woman is fertile not every single day, but in God's beautiful design, He created it that a woman is only fertile with her husband or with a man during a certain 6-day window, we say, a fertile window. So natural family planning takes advantage of this beautiful design that God has created and says, okay, if you can get pregnant during this time, then intercourse can be timed, or the marital embrace can be timed at certain times in the cycle to avoid or achieve or delay pregnancy. So when couples come to me and they want to get pregnant, then we try to focus the marital embrace during those fertile times. When they want to avoid pregnancy, they use the other times that are infertile to come together. And this is a method, so to speak, or just a way of going about it that honors the Catholic Church teaching of the marital embrace being unitive and procreative, bringing a couple together, but also being open to life. So when a couple uses contraceptives, they may be using something physically or chemically that's preventing life from occurring. But with natural family planning, we're using the woman's natural cycle, and the church approves it as a result. It doesn't interfere with the unitive and procreative aspects of the embrace.
Let's talk a little bit about that in case someone might not be familiar, which is possible. Why is the Catholic Church in favor of natural family planning and not the other or the forms of unnatural contraception?
Yeah, so I get this question a lot. People ask me, well, isn't this just Catholic contraceptive? Isn't this just the Catholic version of that? And the answer is no. The mentality around it is so different. And when you really study the woman's cycle and look at the beauty of it and how God has created a man and woman coming together to not be able to get pregnant every single day, but only during certain parts of the day, you realize that we can work with God's design instead of against it. So when we're working with God's design, we're looking at the areas of the cycle that are infertile or fertile, where you could get pregnant and not get pregnant, and timing intercourse around those times. And then when we're working against God's design, that would mean using something such as a contraceptive. So using a barrier or a chemical or a device or something like that that would unnaturally affect the cycle and would cause the couple to not be in line with Catholic teaching, because they are not coming together and being open to life. It is something that is close to life. So NFP is always open to life, despite the fact that we know that sometimes are less likely to get pregnant than others, whereas contraceptives are not open to life.
That's a great explanation. Now, you're Catholic, practicing Catholic, and I think most of our listeners and viewers are. And there are, you just outlined the religious reasons why natural family planning is the way to go, but there are non-religious reasons as well. As a physician, can you touch on those a little bit, please?
Absolutely. So it's very difficult sometimes to diagnose women's health concerns, especially. So when someone comes to me and says, hey, I'm having these troubles with my cycle or my periods and things like that, the first thing that I would love for them to do is to track their cycles. And the amazing part about technology these days is that most women do. Most women have it on an app or record it somewhere when they get their periods, how they are, et cetera, et cetera. But a physician trained in natural family planning can sometimes look at a woman's chart, can just look at that data and say, hey, this might be the diagnosis. Let's order some tests. Or, hey, this isn't right. I see something's going on here. Maybe this is why you're not getting pregnant so easily. Or maybe this is why your cycle's off. Or maybe there's something else going on. I'll give you an example with endometriosis, which is a condition where women may have very painful periods. It might take over 7 years for a woman to get a diagnosis. It's very difficult to diagnose. But if a physician is trained in natural family planning and can look at a woman's charts, and a woman has been learning how to chart her cycles according to a method of natural family planning, then she might have that information to get that diagnosis sooner and get treated sooner. So this is all really important, and it can contribute very positively to health, to fertility, to optimizing chances of pregnancy, and to ensuring women and couples are living their best possible, most fruitful and healthy lives.
What are some of the myths that surround natural family planning?
I think the biggest one is that it doesn't work. So that's what people come to me often and say. They say, oh, you're crazy. Like, that's just the rhythm method. That doesn't make any sense. That's like playing roulette. You're just taking a chance to see what happens, right? And that couldn't be farther from the truth. The way that natural family planning has come after Humanae Vitae called on couples, it was a papal encyclical, and there was a call for scientists, physicians, healthcare professionals to advance this science behind fertility and natural family planning, and it really has done that. There's wonderful places that can use information about natural family planning to help couples avoid pregnancy or achieve pregnancy. And amazing research has been done in this field, to the point that now the method that I teach, for example, uses technology, uses urinary test strips to measure the actual level of hormones in a woman's body to determine when she is fertile based on one of these signs. So the science has come so far that these methods are 98% plus effective for avoiding pregnancy, if that's a couple's goal, and can also be very effective for helping a couple achieve pregnancy. There are studies behind this as well. So I would encourage couples to reach out to people who are actually trained in this, who have data. There's wonderful organizations that compile data on natural family planning now too. So it's from moral standpoint, from a biological standpoint, it certainly is not roulette. There's a lot of information now, a lot of research that is guiding people's decisions, and it's come a long way. It's not your grandmother's NFP, as we like to say.
My guest today on Catholic Forum is Dr. Stephanie Caffey. Her book is titled Totally Yours, The Catholic Natural Family Planning Handbook. Dr. Caffey, in your book, you share stories of couples who use NFP. Would you share one or two with us today?
Sure. So I worked with one couple who has willingly shared their story. And this couple had trouble getting pregnant the first time, had been investigated with a fertility clinic. They couldn't figure out what was going on. But eventually they were able to get pregnant, thankfully. And then the second time they wanted to get pregnant, they came to me and said, we don't want to go through fertility things anymore. It was too hard on our family. We can't manage it. So we want something more natural. So they came to me, and just by using natural family planning, they were able to time the marital embrace accordingly and then get pregnant with the first or second cycle that they tried. So it was really a miracle that that's all they needed. Often there's a lot more intervention that couples might need, but in a simple situation like that, it was a beautiful opportunity to use natural family planning to get pregnant. In other situations, I've had couples come to me and say, hey, my doctor said I absolutely can't get pregnant anymore for these medical risks or these absolute challenging things that might happen in pregnancy. I need your help. What can I do? Do I have to get the vasectomy or tubal ligation, or can I use NFP? And the answer is yes, you can use NFP, and you can use it quite effectively and efficiently as long as you're working with a physician and as long as someone's trained and can help you and you're diligent. So I worked with this couple who was in a challenging situation, and they've been able to successfully avoid pregnancy, has been the very serious directive given to them by their physician for health reasons. They were able to have pregnancies and then now are avoiding, and they've been really happy with the straightforward nature of the Marquette method, which is what I teach, and they've been able to progress with that. So a story on each end of the spectrum, but natural family planning certainly has helped many couples with their family planning goals, which would align with what they've discerned for themselves and God's plan for their family.
Who should read your book, Totally Yours? Is it just for couples?
Good question. So I recommend it. Certainly, I think an ideal audience is engaged couples, married couples, anyone who's struggling with NFP or struggling, why would the church recommend this if couples need it? I also recommend it to priests. If priests are looking for a way to counsel couples on this, then I've had numerous priests in my own diocese say, hey, I've got a few copies and I've been reading it myself and also giving it out to couples. Sometimes I get people that say, hey, I'm on board with natural family planning, but my spouse isn't so much on board. He or she didn't have the training and the background and the formation that I did. What resource can I use? And I think the book is an excellent resource for the formation of a reluctant spouse, as I call it. So definitely couples, people who are single as well, who are wanting to learn more about NFP and prepare for their future vocations, the book would also help them. So there's a wide audience that would certainly help be helped by reading this book.
What has been the reaction so far? It's a fairly new book, correct? What's the feedback?
Right. Yeah, so I released it on the Feast of the Assumption back in August of 2024 with Our Lady's intercession, hopefully guiding its release. And then the feedback has been very, very positive. So it's actually been used by some dioceses as their marriage prep resource. So for the natural family planning section, they've given every couple a copy of this book. Other couples have just come to me and said, hey, this just reaffirmed why we're doing this, and we really appreciate you writing this and making it available to inspire other couples, but also inspire us who've been on this journey for a while and just needed kind of an extra motivator to say, hey, we remember why we're doing this. This might be hard in the trenches, but it's going to be okay. So feedback has been very positive. I'm grateful to help many couples and also to help clergy that might need an extra resource to share with couples as well.
And you do your counseling virtually for the most part, is that correct?
That's correct. So in terms of natural family planning, I run a virtual clinic. My patients can only be from Ontario, Canada, but there are practitioners of natural family planning worldwide, especially in the States. And it's a clinic that allows me to help couples from my region of Ontario in Canada, but they're all over the place, which is wonderful. The doors that have opened through virtual care are great in the sense that, and you could be in the smallest little town somewhere and you can still learn NFP just with the same quality as someone in a larger town who might be closer to a practitioner. So I would encourage couples to look for practitioners in their region, but also if you don't have enough in your region, to reach out and to see what other resources are available worldwide and nationwide.
Yeah, that was going to be my question, if you could take patients from the United States. But I guess for our listeners who want more information, they should just pick up a copy of your book because that's available in the United States,
Yeah,
right?
so my book is definitely available on Amazon in the United States, and it's available on Amazon worldwide. But in the book, there's a list of instructors of many different methods of NFP. So although I teach one method, the book has many different methods listed, has the websites listed of different resources with instructors listed. So you can certainly grab a copy and then decide what method you want to pursue and which instructor you want to pursue it with. I also go through different methods and the advantages and disadvantages of each. So something that can be overwhelming if someone's saying, hey, I don't know where to start, you can look at the book and say, okay, let's look at various methods and see what the advantages and disadvantages are of each of these methods. So I recommend doing that as well to see which method is good for a certain couple at a certain time in life.
So visit Amazon and search the book, Totally Yours, The Catholic Natural Family Planning Handbook, or visit your Catholic bookstore, which they should have it on the shelf, I would think, correct?
We're working on getting it into bookstores as well, but it's starting to be distributed, definitely, yes.
Great. Dr. Caffey, we have a couple of minutes left, and I don't mean to throw you a curveball, but I want to touch on a topic that didn't occur to me until you told your story about your work with elderly and your story about your grandparents. And this is off topic, so forgive me. But here in our diocese, which is the state of Delaware and Maryland's Eastern Shore, so in Maryland and Delaware, both states have been discussing physician-assisted suicide. That's been the law in Canada for years. Can you just take a few minutes and touch on how physician-assisted suicide has affected Canadians?
Sure. So physician-assisted suicide involves the patient requesting death from their medical provider. I'm very clear with my patients that I don't kill them and that I will not be involved. They are welcome to seek these out through any other methods. And it's very easy for them to get in Canada, although there are supposed to be safety checks involved. It's quite easy for someone to get this. From personal experience and professional experience, a lot of these requests for medically assisted death are rooted in hopelessness, are rooted in fear, are rooted in suffering. So what I think we need to pursue and what we should push for as Catholic practitioners and providers and as people who believe in the sanctity of life is better palliative care. Palliative care provides comfort-based care, does not kill the patient, and accompanies them as they suffer by trying to ease their suffering. So for example, if a patient I have is in intolerable pain, then palliative care will treat the pain and will treat it in an ethical way that protects the dignity of the patient and also does not directly cause their death. So I highly recommend that people advocate for palliative care. I don't think safety checks or checks and balances in a system where you have euthanasia or MAID are very effective. In our situation, they haven't been. There's been abuses of the system, a lot of loneliness and hopelessness, unfortunately. There are people that are truly suffering. There are people that are experiencing immense hardships, especially at the end of life. But the answer is not death. The answer is accompaniment. The answer is palliative care. And the answer is good quality medical care from all aspects. So it's the social care, the emotional, the spiritual, and the physical, all coming together to help this person at the end of life. So I could do a whole episode with you on this, Bob, but we'll let this go and we'll certainly keep you in our prayers as well.
Yeah, thanks. I appreciate that because we definitely need it. And it's been, from what I've read, a real disaster in Canada. And we don't want that here in our diocese for sure. Yeah.
No, it's a very challenging thing. And I think people come at it saying we want to be merciful, we want to be compassionate, but it's misguided in the sense that we can be merciful and compassionate in other ways by protecting the sanctity of life and by accompanying people with good quality palliative care at the end of life. And I just think it's not accessible. So in Canada, there are studies saying that very few people actually have good quality palliative care at the end of life. We don't have enough practitioners, there's not enough money for it, funding, etc. So that's something where we should be really focusing our energies. And I'll leave you with one story. I had a gentleman who came to me and said, I want to die, I'm giving up, I don't want to do this anymore. He had these terrible wounds and pain, and it was completely awful suffering. So he would have qualified for that. And he said, I don't know what to do. I don't want to die. So he left it open and he said, I don't want to die. What can I do? But I feel like that might be my only option. And I said, let me treat you. Let me treat you with palliative care. Let's ease your suffering. Let's see what we can do. And we ended up treating his wounds more effectively. We had some specialists involved. I treated his pain. He wasn't even on any pain medication, this poor gentleman. And then he ended up living several more years very happily with a good quality of life, with his pain treated, his symptoms managed. And we were able to accompany him through that difficult time. So there's hope. There's certainly a lot of hope as in this Jubilee year as Pilgrims of Hope. There's hope in the fertility sphere with natural family planning and at end of life as well.
Dr. Caffey, thanks so much for sharing that with us, and thanks for sharing your time. And we hope that God continues to bless you and your family and your practice. And thanks again for being with us today on Catholic Forum.
Thank you for having me. God bless you.